Welcome to Acera's Medicare Transition webinar. We have a lot of stuff to cover today regarding your transition into Medicare. This is kind of a high-level overview of what we're going to cover. I will give you, speaking of high-level overviews, a high-level overview of how Medicare works, what Medicare is. We'll talk about how Medicare and Acera work together, and we'll talk about Acera's Medicare mandate. I will also then go into the details of how Medicare works. We'll talk about parts A, B, C, and D, and all kinds of other details about Medicare. And then I'll show you your Medicare plan options. Okay. And feel free to ask questions as we go along. Oh, and let me go ahead and open up the Q&A so I can monitor that. Okay, first off, Medicare. It is the federal government's healthcare program for seniors, basically. So who is eligible for Medicare? Well, if you're age 65 and older, you are eligible for Medicare. If you're under age 65 and you have certain disabilities, you could become eligible for Medicare. People with ESRD or ALS, which is Lou Gehrig's disease, are eligible for Medicare. The Social Security Administration is the overarching administration that runs Medicare, but within the Social Security Administration, it is the Centers for Medicare and Medicaid Services that do a lot of that work. Okay. Now, if you are currently receiving Social Security benefits, your enrollment into Medicare will happen automatically. So whenever you become age 65, about 3 months before that, you will receive your Medicare card in the mail because the enrollment is automatic. So when that happens, you will start being charged for Medicare Part B, okay? And they will deduct it from your Social Security check. So that will be a monthly deduction from your Social Security check. And we'll talk about what the cost of that is in just a little bit. Now, if you're not currently receiving Social Security, your enrollment will not be automatic. You will have to contact Social Security in order to enroll in Medicare, and you'll do that about 3 months before you turn age 65. And at that point, they'll send you your Medicare card in the mail. And so if you are enrolled in Medicare, but you're not receiving Social Security, then the premium that it costs to pay Medicare for being enrolled in Medicare Part B, that will be billed to you on a quarterly basis because you're not yet receiving a Social Security check. So you'll get a quarterly bill for that. Okay, and then there's a note here that some retirees or dependents who are disabled may be eligible for Medicare earlier than age 65. Okay, so this kind of repeats what I was just saying. If you're not receiving Social Security, the time to contact Medicare to enroll in Medicare is about 90 days before your 65th birthday, okay? And Medicare, usually what it does is it takes effect on the first of the month that your 65th birthday is within. So let's say that you contact Medicare 3 months ahead of time to enroll in Medicare because your 65th birthday is coming up. And let's say your birthday is in March. March 1st would be the day that your Medicare becomes effective. And you can call the Social Security Administration at any point or go to medicare.gov to get a lot of information about Medicare and how Medicare works. But we'll talk a lot about the details of Medicare in this presentation. Okay, so Acera has a Medicare mandate, and that means that if you want healthcare through Acera as an Acera retiree, you can get healthcare through Acera. We offer you a variety of different medical care options. If you are not yet age 65 and you're enrolled in medical coverage through Acera, you are enrolled in one of our non-Medicare plans, one of our pre-Medicare plans, also known as early retiree plans. Then once you become Medicare eligible, ACERA mandates that if you want to continue coverage through ACERA, you have to choose one of our Medicare plans. So we have a group plan and we have a lot of different individual plan options for you to choose from, which we'll get into in a few moments. But you have to move from our early retiree plans into one of our Medicare plans. And that's what we mean when we say the Medicare mandate, because we mandate that you move over to one of those plans. Okay. But it's actually good news for you because it's a lot cheaper to be enrolled in a Medicare plan, and the Medicare plans that we offer can be just as rich in benefits as the plan that you were in prior to Medicare eligibility. Okay, so this is why we mandate that you choose one of our Medicare plans, and this chart gives you an example of that. So in this chart, let's say that you are in the Kaiser Permanente HMO, which is one of our group plans for people under age 65. The premium rate for 2023 is over $900 per month. Okay. Now, let's say in this example, this person has 17 years of service. So they fall into the category, the middle category of our monthly medical allowance subsidy. That's what MMA stands for. And so they would have available to them a subsidy of $462.09 per month. That means their out-of-pocket cost every month is $447.65, because we will take $909.74 out of their ACERA check and send it over to Kaiser to pay for their plan. And then we'll put $462.09 back into their check because they have a subsidy. That means they end up paying $447.65 every month to be enrolled in this plan. Okay, now you're Medicare eligible and you want to switch over to the Kaiser plan, and we mandate that you do if you want to maintain your coverage with Kaiser. Okay, now you'll see that the premium is a lot cheaper, $316.81, and that's because the federal government's coverage kicks in. Medicare kicks in and pays for the majority of your coverage. And so that's why the plans are a lot cheaper. And what these Medicare plans that I'm going to talk to you about, including the Kaiser Permanente Senior Advantage plan, what they do is they provide you a higher level of coverage than Medicare alone will give you. And you'll see that if you have at least 15 years of ACERA service credit when you retire, what will happen is that you'll enroll in one of these ACERA plans that we offer, like through Kaiser or one of the individual plans through Via Benefits, and it won't cost you anything because the premium rates are so low that the monthly medical allowance covers the entire premium rate and your out-of-pocket becomes zero. Now, one thing that you'll note here is that the monthly medical allowance is not $462.09 once you transition over to the Medicare plan, because the rules around the monthly medical allowance state that they will only, for the group plans, and this is our group plan example, for the group plans, they only pay up to the premium amount. So because the premium is a lot lower and it's a lot less than the monthly medical allowance, you don't get to keep the change between 316 and 81 and 462.09. But the good news is that it pays your entire premium, so your out-of-pocket becomes zero. So this is very financially advantageous for you, the member, because you go from paying $447.65 out of pocket in this example to paying zero. So you take home a lot more money in your check once you become Medicare eligible. So the mandate works for you because you pay a lot less, and it also works for ACERA because that is a lot less money that is coming out of the medical reserve fund to pay for your medical care. So you save money and ACERA saves money. Okay, let's break down the different parts of Medicare, because you've probably heard the different terms: Medicare Part A, Part B, Part C, Part D, all this stuff. What those different parts are kind of shorthand for the different federal laws that govern Medicare. And so Medicare Part A provides for hospitalization coverage. So when you enroll in Medicare, what we talk about first is you enrolling in Medicare Parts A and B. So when you enroll in Medicare Part A, that's hospitalization insurance. So it helps pay for Medicare-approved hospital stays, care in skilled nursing facilities, for rehabilitation. It does not pay for long-term care. For that, you should purchase a separate long-term care insurance policy. It'll pay for hospice care, home health care on a limited basis. It'll pay for, I think blood refers to blood transfusions, and that's on an inpatient basis, and hospital care from qualified medical providers. If you have paid into Medicare during your career by paying in for at least 40 quarters, which is essentially more than 10 full-time years worth of work, then Medicare Part A coverage you get for free. You don't have to pay for that because you've already paid it throughout your career when you were paying into the Medicare system. So that's what this little chart here is demonstrating. 40 plus quarters, it's free. There's no premium for Medicare Part A. If you have paid into the Medicare system between 30 and 39 quarters, then there will be a monthly charge. And that for 2023 is $274 per month that you would have to pay to get that hospitalization coverage. If you have less than 30 quarters, then you would have to pay $506 per month to have Medicare Part A. Now, there's a few exceptions here. And let me see if I can find these for you. So if you're married and your spouse, or you have an ex-spouse and you were married for at least 10 years, and your spouse or ex-spouse achieved the 40 quarters, then also Medicare Part A is free for you. And then in most cases, if you buy Part A, you also have to buy Part B, and then you have to pay the premiums for both. Okay, now there's this info down here about the Part A late enrollment penalty. So you'll see this late enrollment penalty on Part A, the Part A slide, and the Part B slide. And the way this works is that Medicare wants you, if you're going to sign up for Medicare, they are going to basically incentivize you to enroll in Medicare as soon as you're eligible by using this disincentive of a late enrollment penalty. So if you don't enroll in Medicare Part A once you're immediately eligible, and this is after you've stopped working. Okay, so if you're still working, you don't have to worry about the late enrollment penalties. Or if you're still on a spouse's Medicare, a medical plan that's provided through their employer and they're still working, you don't have to worry about this late enrollment penalty. Okay, but once you're not in one of those plans, either because you're working and you have a plan, or because your spouse is working and they have a plan that you're enrolled in. So once you're not working and you're Medicare eligible and you don't enroll in Medicare Parts A and B, then they start assessing this late enrollment penalty. And the late enrollment penalty is a lifetime penalty that makes Parts A and B more expensive the later you enroll. So every year that you wait to enroll, you incur a 10% increase in the premium. And that's the penalty. So it gets more and more expensive the later you wait. So for example, well, actually, I can't think of a good example because so I'll just skip over that. But you would get that 10% penalty. I'm not sure what the penalty would be for somebody who is going to get Medicare Part A for free, because there's got to be a base penalty, and I'm not sure what it is. But if you use this information I'm telling you, you can avoid the late penalty. Okay, now let's move on to Medicare Part B. We said Medicare Part A is hospitalization coverage. Medicare Part B is medical insurance for doctor's visits. So it helps pay for approved doctor services, outpatient care, some preventative services, diagnostic tests, and other services and supplies that Medicare Part A doesn't cover. Because this is on the doctor's side. This is not hospitalization. This is more preventative stuff. Or if you have a condition that you need to go to the doctor for, but you don't need to be hospitalized. Now, Medicare Part B has a premium. And I don't think anyone gets Medicare Part B for free. So everyone pays the premium. Now, for 2023, the monthly premium to be enrolled in Medicare Part B is $164.90. You pay this directly to the federal government through either Medicare or Social Security. I think you pay it to the Social Security system. So $164.90 per month is what you pay. Now, having said that, let me just throw in a little caveat here. If you have at least 10 years of a service credit, you'll be eligible for our reimbursement for the lowest standard monthly premium amount, which I'll talk about in a few minutes. So it'll end up, you'll get a subsidy to pay for the cost of this, to help you pay for this. But like I said, Medicare Part B, you do have to pay this monthly fee to the federal government for being enrolled in Medicare Part B. Now, some people will pay more, and I think I have a chart on this coming up. So I'll talk more about the different if you have a higher income, you'll have to pay more than the $164.90. But we'll talk about that in just a minute. Okay, so how do you enroll in Medicare Parts A and B? Okay, so you have this 7-month window that we're looking at to enroll in Medicare Parts A and B whenever you first become eligible. Let me see. Here's a slide on that. So this is the 7-month window. The 3 months before the month of your 65th birthday, your birthday month, and then it says 2 to 3 months after your 65th birthday. I'm not sure why it says 2 to 3. Maybe there's like a caveat in there about that, but I've always been told it's the 3 months before the birthday month and the 3 months after. It's the 7-month window. Okay. And then, like I was saying earlier, your Medicare becomes effective the first day of the month of your birthday month. And I'm not sure why it says following your birthday month here. I guess there's certain circumstances where that might happen. Okay. So Medicare will tell you when it becomes effective whenever you enroll. So you're not going to have to question, when it's effective. You'll see what your effective date is. It'll be either the first day of the month of your birthday or the first day of the month following. And I think it probably depends on when you enroll. Okay, so how do you actually enroll? Well, the best way to do it is to apply online at Social Security. So if you go to and really the best way to do it is to go out to the Medicare's website, okay, which is medicare.gov. And actually, I'll show that to you right now. Oops. Okay, here's medicare.gov. And all you do is you click on Get Started with Medicare. And then it takes you through the steps. You can read more about Medicare. But then if you see step 2, that's sign up. It tells you about when to sign up, how to sign up, when coverage starts. If you're ready to sign up, you just click Ready to Sign Up. And then it gives you instructions about that. And it gives you this link for applying online at Social Security. So it actually sends you over to the Social Security website, and then you can start your online application. So you would just click Start Your Application, and then it takes you through step by step to enroll in Medicare. Now, that's one option. Another option is you can do it over the phone by calling Social Security, and the number is up here. It's 1-800-772-1213. That may take a little more time than doing it online. I think online is probably the most efficient way to do it. You can also visit your Social Security office. If you're going to do that, you may want to make an appointment ahead of time so you're not just sitting waiting around in the queue. Both of these methods, either calling Social Security or going down to the office, there may be some wait time involved with that. If you call Social Security, depending on the time of year or depending on how busy they are that day, you may be in a queue for a half hour or something like that, waiting to get through to them. Okay, so when you're enrolling, you're filling out an application for enrollment in Medicare Part B and Medicare Part A. And there's a special note here. By completing the application, that doesn't mean that you're automatically enrolled immediately. Social Security, what they do first is they determine if you're eligible to enroll. Okay, that's the first step, and then they will enroll you. And they'll send you more information about that once they've determined that you're eligible to enroll. Okay, so we talked about your 7-month initial enrollment period. Now, if you miss that enrollment period, you do have the opportunity to enroll later. And that it's kind of like Medicare's open enrollment, and that's January through March of each year. And if you do that, your coverage becomes effective on July 1st of that year. Now, there again, I want to reiterate this. There's that lifetime penalty that you incur if you miss this initial enrollment period. Okay, so for parts A and B. And every year that you miss it, you get another 10% penalty that you pay on top of the premium that you already owe. Now, there's an exception here, which I already mentioned. If you're currently working and you've already turned 65, don't worry about this late enrollment penalty. There is a process that Social Security goes through whenever you're enrolling. They'll ask you about your employment and when you stopped employment and when you lost coverage through your employer. There's a special part of the form, or it's a special form that you fill out, and they will take that into account, and you will not owe a late enrollment penalty. Okay, so as long as you keep working and you're enrolled in your employer's plan, then you don't have to worry about the late penalty. But as soon as that stops, then that becomes, once you lose that coverage because you've retired or you've stopped working, then that becomes your qualifying event to be able to enroll directly into Medicare, since you're already Medicare eligible. And again, just to reiterate this, that also includes if you've already stopped working and or retired, but you are receiving medical coverage through a spouse's plan through their employer. Okay, so you don't incur the late enrollment penalty for that either. Now, once your spouse retires and they lose that coverage, then that becomes your qualifying event for enrolling in Medicare and not incurring this late enrollment penalty. Okay, so some people will ask if they should go ahead and enroll in Medicare while they're still working. And you can enroll in Medicare Part A while you're still working, because if you have at least the 40 quarters and Medicare Part A is free, you can go ahead and do that, and it's not going to cost you anything. Now, you can enroll in Medicare Part B if you want while you're still on your employer's plan, but there's generally no benefit for doing that because the employer plan is generally the primary plan and usually provides a little bit better benefits than the Medicare plan. And so you're not really going to get a double coverage. It's like duplicate coverage, and you have to pay for Medicare Part B. And if you're still working, you're not going to be eligible for the Medicare Part B reimbursement plan subsidy through ACERA that I'm going to tell you about. So you're just going to be incurring this monthly cost for Part B, and you're not really getting a benefit for it. So if you're still working, don't enroll in Medicare Part B yet until you stop working and you get off your employer's plan. You do have the option, though, if you want to to reject your employer's plan and go ahead and enroll in Medicare if you want to do that. But if you're doing that, you should look at all the benefits that your employer's plan is giving you versus what the Medicare plan is giving you and what the costs are to see if that makes sense for you. Okay, this is the table that I was talking about earlier regarding the different premium amounts. So this is the schedule of premiums that you will owe to Social Security for being enrolled in Medicare Part B. And these are the numbers for 2023. So it's based on income. Now, if your income is as a joint filer, sorry, let's do individual first. As an individual filer, if your income is $97,000 or less, then that means that you pay the base amount, $164.90. Or if you're filing a joint tax return, it's $194,000. If you're married but you're filing separate tax returns, again, it's $97,000. Okay, so that's when you would be paying the base amount. Now, if your income is above that, you can see that there's different brackets that would mean that you would incur different higher costs for being enrolled in Medicare Part B. And again, this is the monthly premium that you will be paying to Social Security, the Social Security system, to maintain your enrollment in Medicare Part B. Now, the income part is going to be based on what they do is sometimes it's known as a 2-year look back. It's your income for the previous 2 years that you filed taxes. So for 2020, actually the income from 2 years ago when you filed taxes. So for 2023, it's going to be based on your yearly income for 2021. If you had a extraordinary year 2 years ago, like let's say that you got a big inheritance and your income was way higher, there's actually a process whereby you can contact the Social Security Administration and you can tell them about that, and you fill out a form, and they will do on an individual basis, they'll do an assessment of other tax years to see if you can be in a lower bracket here to pay less of a Medicare Part B just because that was an extraordinary year. But if your year wasn't that different from other years, you're probably not going to get a reduction in what you pay for Medicare Part B. Okay, now is when I tell you about the Medicare Part B reimbursement plan. So if you recall from other materials that we've sent you and maybe other seminars that you've attended at Acera, we offer a bunch of non-guaranteed benefits. In fact, we offer 4 non-guaranteed benefits that have to do directly with healthcare. So there's the monthly medical allowance, which is a medical subsidy. There's a dental subsidy. There's a vision subsidy. And there's this Medicare Part B reimbursement plan. Since we're talking about Medicare, I'll tell you about the Medicare Part B reimbursement plan. What this will do is if you have at least 10 years of Acera service credit when you retired, or you retired with a service-connected disability retirement, there is this Medicare Part B reimbursement plan that covers the cost at the lowest level, that the lowest standard amount that Medicare charges anyone that year for being enrolled in Medicare Part B. So you've already seen this number, $164.90 per month. That is what, if we go back to the previous slide, that's what you pay to Medicare to be enrolled in Medicare Part B. But if you have at least 10 years of Acera service credit or a service-connected disability retirement, then Acera will put $164.90 into your retirement check to help you pay for your Medicare Part B. So it's a really good benefit that the Board of Retirement has offered, and this is paid out of this medical reserve fund called the Supplemental Retiree Benefits Reserve. So if effectively at the lowest level, if this is what you pay for Medicare Part B, you end up paying zero because you pay this to Medicare and then Acera puts $164.90 into your check. Now, if you pay at a higher level, like let's say you pay at the next level up, you pay $230.80. Yes, you'll have to pay that to Medicare. Okay. And then your subsidy will still be $164.90. So you have to pay the difference. So it helps you pay part of the cost of what Medicare Part B costs you. Okay, there's a few other bits of information I want to point out here. This is a non-guaranteed, non-vested benefit. So this is something that the Board of Retirement offers to our members, and they examine this benefit every year in December and decide to continue it or at what level to continue it. This is a pretty popular benefit. So I've never heard any talk of among board members of adjusting this benefit. And the reserve fund that pays for this has over $1 billion in it. So there's a lot of money there. The reserve fund is as sustainable as it's ever been. So as far as I know, the board is going to continue offering this into the future. So I think this will be continued to be offered for a long time. Okay. But just to say that this is one of those benefits, the subsidies, it's based on available funds in that reserve. And that's why we call them non-guaranteed, non-vested benefits. Now it's only available for you, the ACERA retiree. Not for the cost of your dependents. Now you can enroll your dependents in our plans, but the subsidies only go to pay for your costs. Okay. So if you're enroll your spouse in the plan, they're going to start having to pay the federal government $164.90 per month also, and there's not a subsidy for them through ACERA. Another thing that I want to point out is that you have to enroll in this. It's a one-time enrollment. It's super easy. You just fill out this form and you send it in to us. And once we get it, then you're enrolled in the Medicare Part B from there on out, the Medicare Part B reimbursement plan from there on out, as long as you maintain enrollment in Medicare Part B. You just continue to get it. So it's a super easy enrollment, but you got to remember to do it. And this is your reminder. You're in the Medicare transition webinar. This is your reminder to do that. So we do have this form available as a DocuSign form, and I will show you where to go do that on our website. The time to enroll in the Medicare Part B reimbursement plan is as soon as you get your Medicare card, okay? Because it's going to ask you when you fill out the form, it's going to ask you to provide a copy of provide proof that you are enrolled in Medicare Part B. And that's how we're able to enroll you in the reimbursement. So this is probably in the time leading up to your Medicare effective date. When you've already enrolled in Medicare and they've already sent you your card, then you go ahead and enroll in the Medicare Part B reimbursement plan. So if you go under ACERA, you go under Forms and Publications, you go to our Forms page. This is just one of the pages that it's on. You scroll down to the Medicare Part B reimbursement plan, click DocuSign, the DocuSign button, and then you put in your full name, and it will, you put in your name, your email address, you hit begin signing, it will send you a code to your email, then you put the code in, and then you can start filling out the form. While you're filling out the form, it will ask you for a copy of your Medicare Part B card. Okay, so if you want a good way to do it ahead of time is to go ahead and take a photo with your smartphone of your card and upload that into a place where you can get to it on your computer so you can attach it. Or you can just go to this page on your smartphone, and DocuSign works great on your smartphone. So you take a picture of your card on the smartphone, you go on your smartphone to acera.org/forms, you click the button for Medicare Part B reimbursement plan DocuSign, and then you can just fill it out right on your phone and attach it that way. I mean, you will have to do a little pinch to zoom to read it, but that's a pretty good way to do it. Otherwise, just get your image of your Medicare Part B card, email it to yourself or wherever, you get it on your computer, and that way you can attach it when you do the DocuSign. You can also scan it in to your computer. That's another good way to do it. Okay, so, and I answered this question, where's the Medicare Part B plan application? Yeah, so that's where it is on our forms page, Medicare Part B reimbursement plan. Another time that you may be filling this out is at the time of retirement. And there's a page that we send you to that takes you step by step through the retirement process. I think that form is part of the packet here. Yeah, it is. So if you are doing this at the time that you're retiring because you're already Medicare eligible, you can go ahead and fill the form out at that time. Along with your retirement application and our medical plan enrollment forms, you could fill out the Medicare Part B reimbursement plan application form at that time. That's one of the forms on the electronic retirement packet here. You get to that page by going to acera.org/retire. It's also under members and preparing to retire. And this is the step-by-step process that we take you through when you're preparing to retire. And that is the last step, applying to retire. And you just click here and that takes you to our applying to retire page. Okay, another thing that I want to point out, and we put this in red and bold and underlined, this is not a retroactive benefit. So if you forget to fill it out and a couple of months goes by and you start paying Medicare and then you're in the middle of making dinner and you go, oh, Medicare Part B reimbursement plan, I need to sign up for that. And you sign up for it 2 months after you've already been paying for Medicare, we're not going to go back for that 2 months and reimburse you. So we're going to start putting it in your check as soon as you are eligible, as soon as you start Medicare, but also as soon as you sign up for it. So if you sign up for it much later, then we'll start putting it in your check then. So enrollment is not automatic. You do have to complete the form. One more thing about this is enrollment in an Acera medical plan is not required. So if you have a special situation and you don't want to enroll in one of Acera's Medicare medical plans, you're going to go get a different Medicare medical plan somewhere else. Or you're just going to stick with plain old Medicare and you're not going to enroll in a supplemental Medicare plan. Well, that's perfectly fine. And you can still get the Medicare Part B reimbursement plan subsidy. All you simply need to do again is fill out the form, provide us with your Medicare card that shows you're enrolled in Medicare Part B, and we'll start putting this in your check. Now, if you do that, you're not going to get the monthly medical allowance subsidy that you might be eligible for to pay for your enrollment in one of Acera's medical plans. But you will be eligible for the Medicare Part B reimbursement plan. Again, you have to have at least 10 years of Acera service credit, and this does not include reciprocal service credit with other agencies. This is 10 years earned at Acera working for one of Acera's 6 participating employers, including Alameda County. And then, or you need to have a service-connected disability retirement, because service-connected disability retirements can happen with any amount of service credit. So those are the qualifications. Okay, since we're talking about premiums, let me mention Medicare Part D and Medicare Part D. It's kind of a premium. It's also known as an income-related monthly adjustment, an IRMA. So I talked about Medicare Part A and Medicare Part B. A is hospitalization. Medicare Part B, like in Bravo, is doctor's visits. Medicare Part D, like in Delta, is prescription drug coverage. So whenever you enroll in a Part B plan, medical insurance coverage, that comes with prescription drug coverage. It comes with Part D. Okay. So you're going to have to pay, perhaps, depending on your income, you're going to have to pay for that Part D coverage. And this is paid directly to Social Security. Okay. Now, if you fall in that lowest income bracket where you're earning $97,000 or less as an individual, then you don't have to pay extra for the Part D. Okay, you just have to pay, if you enroll in a separate Part D plan, you just have to pay the plan premium for that Part D coverage. But if you have a higher income, the federal government will charge you a little bit more for that Part D coverage. So the next step up is $12.20 per month, and it goes up to $31.50 per month if you make more than 123,000, up to 153,000, etc. Okay. So sometimes this can be an unexpected extra payment. So that we just want to tell you about this in advance so that you can be expecting it. And I'll talk more about Part D in a few minutes after I talk about the two different types of Medicare plans. Okay, so there's two of these extra Medicare plans. So above the base level Medicare. So like I was saying, you can just enroll in Medicare, plain old Medicare, and you get a certain level of coverage. But what a lot of what we're talking about today are enrolling in these extra plans provided through insurance carriers that give you a higher level of coverage than Medicare alone. Those extra plans through insurance carriers fall into these two categories: Medicare Advantage plans and Medigap plans, or supplemental plans. Okay, so Medicare Advantage and Medigap. Now, here are the differences between these two. In a Medicare Advantage plan, and this is like the Kaiser Permanente Senior Advantage plan. This is our Medicare group plan that a lot of people sign up for who retire from ACERA. Okay, so that's one example of a Medicare Advantage plan. Medicare is assigned to your selected carrier medical group. So in that example, it would be Kaiser Permanente. You have to select a primary medical doctor when you're signing up for that plan. You have to get your primary physician to provide a referral out to any specialists that you want to see or that you need to see. Excuse me. Most of these have Part D built into it. So you don't need to go out and get a separate Part D plan from your insurance carrier or from another insurance carrier. That's already baked into these Medicare Advantage plans, okay? The copays may vary. The copay for the Kaiser Permanente Senior Advantage plan is $10 per month. So it's a very low copay because it's a pretty rich plan. And then there's a service area that you have to reside in. So for our Kaiser Permanente Senior Advantage plan, it's based on different service areas in California, and you have to be a certain different distance from a hospital, or you can't enroll in the plan. Our service areas for the Kaiser Permanente Senior Advantage plan are, in general, it's the Bay Area, Sacramento area, Fresno area, Southern California, including the Los Angeles and San Diego areas, and Santa Cruz. If you're not living in one of those service areas, then you cannot enroll in the plan, and then you would be choosing an individual plan through Via Benefits, which I will talk about the individual plans through Via Benefits. Okay. So that's the Medicare Advantage plans. Then you have these Medigap plans. Now, in contrast, because we're just talking about service areas, the service area is the United States. So you don't need to live in a specific service area to enroll in one of these Medigap plans. And these are the plans that we offer. A lot of the plans that are offered through Via Benefits are these Medigap plans. I do think there are some Medicare Advantage plans offered through Via Benefits that you can access if you live in the United States in the service area for that Medicare Advantage plan. But otherwise, you are looking at a Medigap plan. Now, in Medigap plans, your Medicare is not assigned to a selected carrier medical group. You don't have a primary medical physician. You can go see any medical doctor that accepts Medicare nationwide. But you got to be careful because not all doctors accept Medicare. So you just got to call and ask them ahead of time. Or I'm sure that you can, there's a database online that you can search and see who accepts Medicare through your carrier. Okay, now there's no referral needed when you want to see a specialist. So you want to go to the dermatologist, you just go to the dermatologist. Okay, as long as they also accept Medicare. So you want to check that ahead of time. These are medical only. It does not have a prescription component. Okay, so the Medigap plan itself does not have a Medicare Part D plan baked in. So then what you need to do is enroll separately in a Medicare Part D prescription drug plan. Now, Via Benefits is going to help you do that. They'll help you pick if you're going to get one of these Medigap plans through Via Benefits. They'll help you pick your Medigap plan. They'll also help you pick your prescription drug plan, and we'll talk about that in just a minute. So don't worry about like the process of having to find one of these. It's almost a concierge service. They help you find exactly what you need. So don't get concerned about that. Okay, now different plans will have different sets of copays, different deductibles. It's all based on the plan that you select. Via Benefits will tell you all about that in advance and help you select the plan that's right for you. And again, the United States is the service area. So that's the difference between these two types of Medicare plans. Now, here's what we offer. Here's what Acera offers. Now, you'll see that this table is separated between if you're not Medicare eligible versus if you are Medicare eligible. So before Medicare eligibility, your options are these 3 group plans through Acera. So we have the Kaiser Permanente HMO, United Healthcare Signature Value HMO, United Healthcare Signature Value Advantage HMO. Those are our group plan options. And also, if you live outside the service areas of these and you're not Medicare eligible, you can find an individual plan through Via Benefits. Okay. Now, once you become Medicare eligible, your options become different. Okay. If you live in one of those Kaiser Permanente service areas, then you have the option of selecting the Kaiser Permanente Senior Advantage plan. And so you can stick with Kaiser and you can enroll in our group plan that we contract with Kaiser, the Kaiser Permanente Senior Advantage plan. Now, if you don't live in one of those service areas, or if you just don't want to pick the Kaiser Permanente Senior Advantage plan, you can find a plan through Via Benefits. And let's say that you like United Healthcare. Well, you don't see that on the list. We don't have a group Medicare plan through United Healthcare, but there are various United Healthcare plans available as individual plans through Via Benefits. So if you like United Healthcare, they'll help you find a United Healthcare plan. It'll be an individual plan through Via Benefits. And in general, you need to live in the United States because for at least 6 months of the year to enroll in one of these plans. So that's the standard for that. Okay, a few more details about the Kaiser Permanente Senior Advantage plan. This is by far our most popular Medicare plan. I think we have maybe upwards of 4,000 or 5,000 retirees enrolled in this plan. I can't remember exactly, but it's something around there. And so this is what a lot of people select. Okay, so this is a senior, a Medicare Advantage plan. You see the word Advantage in there, it's an Advantage plan. And so it conforms to this set of rules. Okay, going back a couple of slides. You can see that the premium, the self-premium is, sorry about that, $316.81 for 2023. And then there are different combinations of if you want to enroll your spouse or your family members. There's more combinations. If you go to our guide, if you go to acera.org/guide, that is our annual enrollment guide that we send out to all retirees every year in your open enrollment packet. There's different combinations based on whether you're both Medicare eligible or just one of you is Medicare eligible and which one of you is the Medicare eligible one. So you can check out all those premiums in our guide at acera.org/guide. But the point here is that there's a little bit there's higher premiums depending on which family members you want to enroll. If you're both Medicare eligible, the premium is $633.62, which is, I think, essentially double what the self-premium is. I mentioned this before, the copay is $10 per month, which is pretty low There's allergy treatments, hearing and vision exams, and immunizations are all included. You have to enroll in Medicare parts A and B, with certain exceptions. Okay. So if you, like I was saying earlier, if you're enrolled in, if you paid into Medicare for 40 quarters and you're getting Medicare Part A for free, you just go ahead and enroll in Medicare Part A and B. Okay. Now, there are a lot of ACERA members and ACERA retirees that don't pay into the Medicare system because they are not, or the Social Security system because they're not Social Security integrated. A lot of them are safety employees, which are sheriff's deputies and our probation officers, are not paying into the Medicare system. Okay, so maybe you didn't pay into it for the quarters that you need, or maybe you have 0 quarters in because you've always been a safety member. And that's okay. You can still get coverage, and in fact, you can still enroll in Medicare, and in fact, you can still enroll in Medicare Parts A and B. Now, if you did pay into the Medicare system with the 40 quarters, Medicare Part A is free for you. But if you didn't, you can still enroll in Medicare Part A. It's just that there's going to be a cost for enrolling in Medicare Part A. Okay. There is this option here. Okay. And I'll give you some caveats about taking this option. But if you're in that category, if you're one of the safety members and you don't have the 40 quarters and you enroll and you retire from ACERA, you become Medicare eligible, and you enroll in the Kaiser Permanente Senior Advantage plan, we have a deal worked out with Kaiser where they will let you enroll in this plan, and you only need to enroll in Medicare Part B. So that means that you only have to pay the Medicare Part B premium to the federal government. And then you can even get the Medicare Part B subsidy if you're eligible for it. And you don't need to enroll in or pay for Medicare Part A to be enrolled in this plan. Okay. So that is something that you can do. Now, the caveat here is that this is a current agreement that we have with Kaiser Permanente Senior Advantage. It's possible that will not be something that's offered, in the future. It's a possibility. We've been offering it for a number of years. I haven't heard anybody talk about that going away, but that is a possibility that it could go away in the future. Or maybe you move and you can't be enrolled. You move out of the service area and you can't be enrolled in the Kaiser Permanente Senior Advantage plan. I'm not sure that there are a lot of other carriers that would offer a plan where a Medicare plan where you are not enrolled in Medicare Part A. Okay. And what happens in that case, then if you needed to enroll in Medicare Part A later, then you would incur those lifetime penalties. Your premium, your monthly premium that you pay to Medicare for Medicare Part A would be higher by 10% for each year that you did not enroll in Medicare Part A. So it's a little bit of you got to weigh that back and forth, whether that makes sense for you, because if you do take that option, then you're not paying the federal government for Medicare Part A, and that could go on for many years. So you're saving a lot of money, and that could make up for if later you do have to pay more for Medicare Part A than you would have otherwise. Then you did save a lot of money for those years. So it's just something that you have to think about and weigh out and decide: are you going to stay in the Bay Area? Or are you going to stay in California in the service areas? Or is there a possibility that you're going to move out of the area? Then you might want to start paying for Medicare Part A. Okay, I see a question up on the board. I currently have health insurance with my spouse's agency. I turned 65 in March. When do I have to sign up with ACERA for health insurance? You don't necessarily have to sign up with ACERA for health insurance. So it's just one option that you have. Okay, so turning 65 is a qualifying event for signing up for one of our Medicare plans. Okay, so you turn 65 in March, your birthday is in March. And so because that's a qualifying event, you could enroll in one of our plans at that time. Okay, so I advise you to go ahead and look at what the plan offers based on your particular situation, what the potential costs would be for enrolling in Acera's health insurance plan at that time. And in that case, you would probably get rid of your spouse's plan. Now, you don't have to do that because as long as your spouse stays working, you can continue to stay on their coverage and you will not incur a late enrollment penalty. So let's say that they keep working until, September of this year, or they work for another 3 years or 5 years, and they keep allowing you to be on their plan, so you maintain coverage on their plan. You're not going to be incurring late enrollment penalties, so you could just stay on their plan if you like. And so what I advise is just look at a comparison between the two plans. You can call each plan, and they will give you I think it's called a schedule of coverage of what each plan covers, and you can compare them side by side, and then you compare the costs side by side and see what makes sense for you, which you want to go in. Now, let's say that your spouse then, let's say your spouse decides to retire, in September. At that point, that's a qualifying event because your spouse is going to lose coverage, and then so you could get right into our Medicare plan, one of our Medicare plans, if you want to at that point. And then beyond that, you have our open enrollment, which is November of each year, if you want to switch coverage. So I hope that answers your questions. One more thing I want to point out about the Kaiser Permanente Senior Advantage Plan is this sort of new benefit that is offered through the plan, through the Acera's Kaiser Permanente Senior Advantage Plan. So you can go out and get your separate Kaiser coverage, but it's not necessarily going to include the Silver and Fit. This is something that our Board of Retirement decided to add to the plan, and this is something that they pay for to be in the plan. What this does is it gives you a free gym membership. There are tens of thousands of participating fitness centers in the network in California that you can choose from. And so what you do is you go out to if you're enrolled in the Kaiser Permanente Senior Advantage Plan, you go out to the Silver and Fit page. There's a search function where you can search for a fitness center, and you join the fitness center through Silver and Fit, and you don't pay for it. It's a free gym membership. Some of the fitness centers, all of them are going to include cardio and strength training. Some of them even include saunas, pools, whirlpools. There's also, in addition to any classes that come with your gym, Silver and Fit offers their own classes through the program. These are virtual classes. There's yoga and strength training and cardio. I'm not sure why swimming is on there because that's not a virtual class. That would be offered through your gym. And there's also home fitness choices. So you can get one home fitness kit per year. One of the fitness kits even has like a Fitbit type thing that you get just for free as part of the plan that you can hook up to your smartphone and track your fitness. So it's a really powerful add-on that the board decided to add on to the Kaiser Permanente Senior Advantage Plan. And it's something that we did as a trial in 2022. And it was successful enough where they decided to keep it for 2023. It is something that they will continue to look at, and it's dependent on people taking advantage of it. So if a lot of people aren't taking advantage of it, then they're not going to pay for it. So go ahead, if you sign up for the Kaiser Permanente Senior Advantage Plan, sign up for Silver and Fit and start going out to the gym. Find one with a sauna, and you go sit in the sauna, or go swim in the pool. Okay. Yeah, there's also thousands of digital workouts. You can even get a personalized exercise plan. There's more information if you go to silverandfit.com. There's more information out on Acera's website. And if you're already in a gym and you like your gym and it's not on the list, you can even request for your gym to be added. Go to acera.org/gym and it will give you instructions on how to do that. Okay, question. Kaiser sent out a group Medicare election form for Kaiser Senior Advantage HMO with a letter from Acera. Do I fill this out or do I sign into Acera and fill something out? Um, how many days before I turn 65 do I do this? So we do have two forms that you need to fill out to enroll in the Kaiser Permanente Senior Advantage Plan. One is that form that Kaiser sent you. That is their form. And one is our form. You can go ahead and fill those out in that 90-day period before your 65th birthday month. And that is a good time to fill those out. And I can go back over to our website and show you that, just give you an example. So going going on our retire page, you can see that there's this medical plan enrollment form to fill out, and there's also this Kaiser Permanente Senior Advantage enrollment form. So if you want to fill out the one they sent you, you can do that. If you want to fill it out in DocuSign online, you can go ahead and do that. And that may be easier for you because we do have that form in DocuSign. And that way you don't have to, get a hand cramp writing everything over and over. And worry about the mail. So one place to find that is at acera.org/retire. We also have both of those forms on the forms page. I don't think they're right next to each other, but it's in alphabetical order. So the Kaiser Permanente Senior Advantage form is here, and then our medical plan enrollment form is here. Okay, let me tell you about Via Benefits Medicare plan options, because we already talked about the option with the Medicare Advantage plan through Kaiser Permanente, the Kaiser Permanente Senior Advantage plan. Okay, so like I said, if you live in the Kaiser Permanente service areas, you could choose the Kaiser plan, or you could choose a Via Benefits plan if you don't want the Kaiser plan. Or if you live anywhere in the United States, you can choose a Via Benefits plan, Via Benefits Medicare plan through Acera. These are not group plans, okay? These are individual plans. And you see the word Medicare exchange here. Via Benefits is what we call a private health insurance exchange. It's a company that we contract with, and they basically work with 100 different insurance carriers to allow you access to 1,000 different plans. Okay, now they're not going to make you choose between 1,000 different plans. They're going to narrow it down for you to what works for you. But that's just to say that this is a company that we contract with to help you find the best plan that's right for you. So Via Benefits. The way it works is that Via Benefits helps you enroll in an individual plan with an insurance carrier, and you are going to pay a premium directly to that insurance carrier. Okay. Now, if you're eligible for a monthly medical allowance for Acera's monthly medical allowance, which is the medical subsidy that helps pay for Acera's medical plans, you'll still be eligible for that when you're choosing an individual plan from Via Benefits. And the way it works is that Via Benefits will open up a health reimbursement account for you at their facility, and Acera is going to send your monthly medical allowance amount that you're eligible for over to Via Benefits, and they're going to put it in your health reimbursement account for you. And then it's going to sit there and wait for you. Okay. Then you enroll in an individual plan through Via Benefits. Okay. So let's say you enroll in a United Healthcare plan, and you're going to have to start paying a monthly premium to United Healthcare directly. That's going to come out of your bank account. Okay. Now you're out some money. What you do is you submit a reimbursement claim back to Via Benefits, and they will pay you your monthly medical allowance amount out of your health reimbursement account to reimburse you for the expenses that you incurred by having this medical coverage. For those recurring payments, they will help you set up automatic payments to your insurance carrier that will be deducted directly out of your bank account. They'll help you set up automatic reimbursements that come from your health reimbursement account at Via Benefits. So it'll all happen automatically. You don't really have to do anything besides the initial setup. The only other things that you would need to submit claims for are any additional expenses you incur, because there's this extra kind of benefit that you get by having an individual plan, that not only are your monthly premiums covered by the monthly medical allowance, any copays and deductibles can also be paid for, reimbursed out of that monthly medical allowance money that's sitting in your health reimbursement account. So this is an extra kind of little advantage, that the little kind of extra benefit that the Board of Retirement set up to help you pay for the cost of your coverage. And one thing that I just want to point out here is Sarah's monthly medical allowance and the Medicare Part B reimbursement plan are two different benefits that we offer. They're two different subsidies. The monthly medical allowance helps you pay for what you pay directly to your insurance company for these extra plans that you get on top of Medicare, like through Kaiser Permanente or United Healthcare or any other insurance company. That's what the monthly medical allowance is for. The Medicare Part B reimbursement plan is to help reimburse you for the cost of what you pay directly to Medicare to be enrolled in the base Medicare system. Okay. So some people get those things confused. They're two different subsidies. Okay, now one thing that they are wanting me to point out here is that the monthly medical allowance only pays for your medical expenses. You can enroll your family members into your plan, but it only pays for your medical expenses, not your family's medical premiums and expenses. Okay, so the way that you enroll in a plan through Via Benefits is not the same as you enroll in one of our group medical plans, because I was just showing you our website. I was showing you our medical plan enrollment form. That's how you enroll in our group medical plans. You don't do that for Via Benefits. Okay, you don't need to fill out our form. It's an online enrollment that you can do, or you can do it by telephone. And we find that a lot of people do it by telephone because you get very precise one-on-one help from a licensed benefit advisor at Via Benefits. The benefit advisors at Via Benefits are they're licensed in every state that you might need to get coverage in. They're salaried. They don't get any commissions, and that means they're non-biased. And I say that to say that they're not going to try to put you in a particular insurance carrier because they get a little bit more commission from a particular insurance carrier versus another one. No, that's not how it works. They just get a salary from Via Benefits. Their whole job is to help you get into the plan that's right for you. So when you call them, what you want to have ready is an idea of how much you might want to spend on health insurance. You can also have ready like where you're going to live if you're not going to live in the place that you're already living. Otherwise, you just tell them what your address is and they'll find plans in that area. You can tell them what doctors you like to visit or want to visit. You can even tell them what prescription drugs you need. So you want to have all that information ready when you give them a call. And they even have a prescription drug program that they'll input all of your drugs in, and it will find the best Medicare Part D plan for you. So what they're going to help you find is a Medigap plan or a Medicare Advantage plan for you in your area that works for you. That's based on what level of coverage you're looking for and how much you want to spend. And if you're choosing a Medigap plan, they'll also help you find a Medicare Part D plan that works for you based on the prescriptions that you need. Or if you don't take prescriptions currently, they'll help you find a plan that works for you that you can tack on to the Medigap plan, so that you'll be enrolled in the Medigap plan and the Medicare Part D prescription drug plan separately. The plans are nationwide. And again, it covers premiums, copays, and deductibles, and medically necessary costs. The monthly medical allowance does. And like I was saying, there's this auto pay and direct deposits available. This is important. Okay, so any reimbursements that you're going to claim need to be done by March 31st of the following year. So let's say that you are already enrolled in a plan through Via Benefits in 2022, and there were some co-pays that you paid for visiting the doctor, and you haven't gotten reimbursement from those yet because you haven't gotten around to it. Well, you have until March 31st of this year to get reimbursed for those, or else the money goes back to Acera. Okay, so that's something to be cognizant of. You do have an online account through Via Benefits where you can track the status of your health reimbursement account, and any reimbursements that you have, you can submit reimbursements there. I think they have an app where you can submit reimbursements, so you don't have to fill out forms. So it's a pretty good system over at Via Benefits. And this is the thing that I was telling you about earlier. They have this software called the Prescription Profiler, where they will input all the prescription drugs you need, and it will tell them what the best Medicare Part D plan is for you that provides the best coverage for the drugs that you need at the lowest cost. Okay. Open enrollment, Acera's open enrollment, is your annual opportunity to assess your benefit needs and make changes. Okay, so let's say that a little bit later on, after you're already enrolled in Medicare, you want to make some changes. Maybe you enrolled in a Via Benefits plan and it's not working out for you, or you want to change your Medicare Part D prescription drug plan, or you just want to simply call Via Benefits and see what the different, plan options are for this year for your prescription drugs or your Medigap plan. Maybe you want to see if there's something that's a little bit lower cost or provides a little bit better coverage or something like that. Open enrollment is your annual opportunity to do that. And that's November of every year. We send out lots of notices about it. We send you an open enrollment packet in the mail every year in October. In fact, Via Benefits open enrollment is extended. It's a little bit extended. It's more than the month of November to give you extra time. And it will tell you in your packet what the specific dates are for that. So that's our annual open enrollment opportunity. Okay, so here's a chart of the monthly medical allowance amounts for our Acera-sponsored group plans, and also for people who are in individual plans through Via Benefits. The top chart are the monthly medical allowance amounts for all of our group plans, and also if you're in a Via Benefits individual plan but you're not Medicare eligible. These are the amounts for 2023. So if you have at least 20 years of Acera service credit, you get the 100% amount of the monthly medical allowance, which for 2023 is $616.12. If you have less than 20 years, but more than 15 years, you get 3/4 of that, which is $462.09 per month. If you have if you don't have 15 years, but you have at least 10 years, you are eligible for the half amount of the monthly medical allowance, which is $308.06. Okay. So you can see that if you have less than 10 years of Acera service credit, you are not eligible for the monthly medical allowance. The one exception to that is if you have a service-connected disability retirement, then you are eligible for the full monthly medical allowance amount every year. Okay. Now, again, I'd just like for you to remember that these amounts only pay up to the group plan premium. So if you remember, if you enroll in the Acera Kaiser Permanente Senior Advantage plan, the monthly premium is $316 and change, I think, or was it $361 and change? Something like that. And it only pays up to that amount. So you don't get to keep the change above that. But if you are not yet Medicare eligible and you're in an individual via benefits plan, you would get the full amount into your health reimbursement account to pay for your expenses. Okay, now, because this is a Medicare transition webinar, this is a good concept to understand, this table down here, which is there's a separate set of amounts for people who are enrolled in individual Medicare plans through via benefits. The reason that this is because the board found that when we first launched via benefits many years ago, this replaced a very expensive plan, and they found that the premiums for these Medicare plans offered through via benefits are very inexpensive. They average around $200, and it's still that way. They're very inexpensive. So they have a slightly lower set of monthly medical allowance amounts for the people who are enrolled in individual Medicare plans through via benefits. So you can see that the full monthly medical allowance amount is $471.99 for 2023 if you have at least 20 years of service. 15 years is $353.99. 10 years is $236 even. So what will happen is that each year at the beginning of the year, we take the full year's amount that you are eligible for and we put it into your health reimbursement account over at via benefits. And then they will reimburse you for your monthly expenses. And we find that 90% of the people who have at least 20 years of service and around that amount of the people who have at least 15 years of service don't run out of money. It's fully sufficient to cover all of their premiums, all of their deductibles, and all of their copays through the entire year. Usually what the people who are not in the 90% are people that have very expensive prescription drugs, like specialized prescription drugs that they need to pay for. So that's how that works. Okay, let me talk about qualifying events. Oh, there was one more point that I wanted to make. It was back when we were talking about via benefits and Medicare Part D plans. When you start to become Medicare eligible, when that time is approaching, you're going to get a lot of junk mail, okay? And some of this junk mail is going to look official, and some of it might even look scary, and it's going to tell you things that, you gotta, timing is of the essence. You got to choose something or other. There's a lot of scam artists out there, and there's a lot of legitimate companies that offer things, and they market in a scammy kind of way, and they try to make it look like some legitimate communication from like Social Security or legitimate communication from Medicare plan. So just be cognizant of that. Okay. You can look out for communications that come directly from Kaiser Permanente. Look out for communications that come from Acera. Look out for communications that come from via benefits. Okay. And the reason that I'm talking about it with Part D specifically is because you'll get a lot of advertisements for Part D prescription drug plans. And they'll want you to sign up for a separate plan because they know that if you choose a Medigap plan, that you need to choose a prescription Part D prescription drug plan. So don't make the mistake of signing up through you go through the whole medical coverage thing. You sign up for your plan, okay, and then you see one of these offers that look good for signing up for a Part D prescription drug plan, and you go ahead and sign up for it. That could affect your medical coverage. If you're enrolled in the Kaiser Permanente Senior Advantage plan, since Medicare Part D is baked in, if you were to go out and sign up for a separate Part D prescription drug coverage, that would mean that we would have to eject you from the Kaiser Permanente Senior Advantage plan because you can't be double covered. Okay, so you don't want that to happen. Now, let's say that you sign up for a via benefits Medigap plan, and you also sign up for a prescription Medicare Part D prescription plan to go along with that through via benefits. Now, let's say again, in this example, that one of these offers looks enticing, that you get in the mail, and you sign up for a separate Part D prescription plan. Well, again, you can't have double coverage So you would get ejected from just your Medicare Part D prescription drug plan that you signed up through via benefits. And chances are via benefits already did the prescription profiler for you. So whatever plan they found for you is going to be the cheapest plan. So I would just, when you're choosing your plan, just stick with the plans that they are offering you. And that way you can use your monthly medical allowance to pay for the cost of the plans, and you won't get ejected from the plans that we offer. And just be cognizant of scam artists who are sending things that look official. I bought a house, and I got this letter in the mail that looked like it was from the county, and it looked like it was some fee, some like assessment fee or something, and it looked absolutely official, except for the address that it wanted me to send like $95 in, or some nominal amount, but they do enough of those, and that's how they make their money. It was like or maybe it was like a recording fee or something. But what it really was, it was a scam for they were going to provide some piece of information that there was some way they had it worked out where it wasn't exactly a scam, so they couldn't get sued, but it was very scammy. And so they will do this all the time around this time for you. These scam artists will do it for Medicare. So just be really cognizant of the junk mail that you're getting, or things that look official around Medicare enrollment time. Okay, qualifying events. These are the times when you can switch coverage. Loss of coverage is one of the main qualifying events. So you retire, you stop working at your job, that's loss of coverage. So that means that we can immediately get you into a new plan. And usually the way this works is you have 30 days after a qualifying event to make your changes that you need. So it is kind of a tight window. I recommend doing it at the beginning of the 30 days so you don't have any surprises toward the end. But going into retirement, that is a qualifying event, and we will get you right into one of our plans with no gap in coverage, and your retirement specialist will help you do that. Or we had this example a few other times during the webinar. You have coverage through your spouse, and your spouse retires or quits working, or otherwise loses their coverage to their employer. That loss of coverage, if you're covered through them, that is also loss of coverage, and it's a qualifying event, and that will allow you to get into different coverage through Acera. If you relocate out of the service area for your plan, that's essentially like you're losing coverage, and so that also gives you the opportunity to enroll in a different plan. And usually what happens is that there's a different set of plans that you're eligible for at the new place that you're moving to. Our annual open enrollment is another time when you can make changes to your plan. Becoming Medicare eligible is a qualifying event. Retiring after age 65 is a qualifying event for getting into Medicare coverage. And that sort of goes hand in hand with the loss of coverage idea, is that your coverage through your employer is ending, you're retiring, now it's time to transition into a Medicare plan. Marriage is a qualifying event because your family status has changed. Divorce is a qualifying event for the same reason. You can change your coverages at that time. Also, a new state registered domestic partnership or dissolution of a state registered domestic partnership are all qualifying events. Okay, so we're closing in on the end here. If you move out of the service area, if you're planning on moving out of the service area, please don't forget to look into the available coverage prior to moving. So this should be part of your planning process when you're moving. You go ahead, and if you're moving within California and you're in Kaiser Permanente Senior Advantage, go ahead and give Kaiser a call, tell them where you're thinking about moving to, and they'll tell you whether you can maintain your coverage in the Kaiser Permanente Senior Advantage plan. Because you might think that it's in the area, in the service area, but you don't really know for sure until you call them. So always call them and ask them. Okay. And alternatively, if you know that you're moving out to somewhere that is not in that service area, like any other state in the US, go ahead and give Via Benefits a ring prior to moving and ask them what the health plans are available, and go ahead and plan all that out in advance. And that way, you won't experience a gap in coverage, like you won't risk a gap in coverage um, when you are transitioning to a new place that you're living, or you won't risk being in a plan that you can't find doctors in because you've moved to a new area. Okay. Also, feel free to reach out to Sarah for assistance with moving. Please always complete our address change form. We always like to remind people of this. When you're doing all your address changes, you send the form into the post office, you change your address with all your credit card companies. Go ahead and change your address with Sarah by filling out our form. This is the only way that we are allowed to update your record, and this is how we keep track of where you are moved to, so that we can send you official correspondence. Because we do find that people, once they set up their direct deposit and they retire, sometimes they just disappear and we don't know where they live, and it's hard to send them official correspondence. It's also important because we'll continue to send you our annual report, but additionally, most importantly, your open enrollment packet every year. We send that in the mail. It contains all of the new information about whatever the healthcare plans are going to be next year, all the new premiums, all the new different features of the plan, all the new options, and we need to know where to send that. So please keep your address up to date with us. Also, another consideration, and this really doesn't have much to do with Medicare, but if you move outside California, you're not going to owe California income tax. So you can go ahead and fill out the California tax withholding form to take it down to 0, so that we're not withholding California taxes anymore. And then that address change form can be found on our forms page at acera.org/form. You can email us questions at any time at info@acera.org. That is a good place to email us. We are always ready to assist you. We answer emails every day of the week, usually within a 24-hour turnaround is our goal. We are recording this, and we'll post it out on YouTube and out on our website within the next few business days. And we also have a call center here. The phone number isn't up here, but I just want to mention that we do have a call center. The phone number is 510-628-3000. Okay, so that's 510-628-3000. They're open every day to take your calls. So if there's some question later on in the day that you forgot to ask, and you feel like you really want to know what the answer to it is, go ahead and call us at any time. That's their entire job, is to assist you in our call center. Okay, so on behalf of Acera's board and Acera's staff, I want to thank you for spending this time with us, and wish you a beautiful retirement, a beautiful Medicare enrollment, and a beautiful rest of your day. So thank you very much.